I was diagnosed with narcolepsy with cataplexy at age 24 as a law student. I honestly thought my future was shattered. While in law school, I watched symptoms and treatments just take over my life, and it really was a nightmare. A few years ago, I was so thrilled to learn the FDA would launch their patient-focused drug development initiative, and that narcolepsy would be considered for this program, in which the FDA would talk firsthand to patients to learn about their experience living with disorders. Living in DC, I drove to the FDA campus. In that meeting, there were some of the most incredible health policy leaders and rare disease advocates, and I quickly realized this program was important. So I made sure to attend every single meeting and launched a community campaign to get the community involved and hopefully get narcolepsy into the program. Narcolepsy was chosen as one of the 20 diseases for the patient-focused drug development initiative, and I worked with a coalition of community members to prepare the community. I know the FDA was a little concerned about our meeting because it was the first rare disease to go through the program. I wasn't concerned at all. As I like to say, we may be rare, but we've got roar.
I'm 10 years old and I have brain cancer.
Gabriella Miller became the unofficial national spokesperson for childhood cancer awareness. She worked tirelessly despite arduous chemo and radiation treatments to raise money for childhood cancer research through her foundation, Smashing Walnuts. Her tumor was the size of a walnut, so to symbolically destroy the disease, she smashed away whenever she could with anyone who would join her.
Do whatever you want with this. But I just have to say it. Talk is we need actions.
And that was Gabriella. Always direct, always delightful. Regardless of her fate, she left this world laughing.
When you're diagnosed with pemphigus or pemphigoid, you may feel like you've lost control. It's important to be in control of your disease and not let your disease control your life. A great way to do this is through self-advocating and advocating for others. Advocacy creates change, leading to new research and treatments. I encourage you to write letters, schedule meetings, and build relationships with your representatives and senators. Ask them to support legislation that affects your quality of care and your access to treatment. I challenge you to speak up for yourself and others who are affected by pemphigus and pemphigoid.